In this video, I want to talk to you about what is sciatica, what can cause it, and how you can help to get rid of it. Don't forget, if you like our content and you want to see more from us and more videos to help with your health and well-being, make sure you subscribe to our channel and hit the bell so that we can notify you as soon as we launch any new content. Before I dive into the content of this video, I just want to make it clear that this video is really just for educational purposes only. In diagnosing sciatica, and if you have it, we would always recommend that you get in an accurate diagnosis from a trained medical professional. But what we wanted to do, if you have been diagnosed or are aware that you're suffering from sciatic symptoms, is to be able to give you some tips to understand why you're getting that and also what you could be doing to try and help your symptoms. So what I'm going to do is pop over to the whiteboard to start to explain to you a little bit about what sciatica actually is. So I wanted to start by explaining what sciatica actually is. Now excuse the horrible artwork here, but hopefully you get the point, in that this is your back and these black lines here are your spine, or what we call your vertebrae. And in between those, these blue sections here, we have discs that sit in there. Now, in those spaces, run out of those are nerves to supply the rest of our body. Now, at this level here, we have at the lower back, the sciatic nerve starts, and that comes out of the back and it runs right the way down the leg towards our toes. So the problem when we get sciatica is that we've got a irritation or an impingement on this nerve, and this can happen at a few different areas, but the point is wherever it happens it can affect us right the way down to our feet. So we might have a problem, typically something like a tingling or a pins and needles sensation experienced at the feet, but actually this could be a problem going on at the back where the nerve is being impinged. And how we typically experience or suffer with sciatica could be sensations like pins and needles, tingling, burning sensation, loss of feeling, are all things that lead us towards thinking that it could be a nerve condition. But what's important to understand is that we don't need to just be checking the area of where we're suffering the pain. We need to be thinking right the way through it, throughout the sciatic nerve, to be looking at some of the key areas that could be impinging that nerve in order to release the impingement to ease the symptoms. So one area that the sciatic nerve can become impinged is at the disc area or lower back area. So the discs sit in between our vertebrae, and they're there to act as shock absorbers and give structure to the spine and things. So they're very helpful. But if we think of the discs a little bit like a donut, they are there and they have fluid inside them. So that's our jam inside of a disc. And what can happen is these discs can bulge. You may have heard the term bulging disc or herniated disc, prolapsed disc, or commonly termed slip disc. And what happens here is that the disc can bulge, and some of that jam fluid can almost bulge out, or it can actually come out altogether. But what that means is we have our disc here, and here with this red bit you can see this bulging disc, this bulging out of its normal space. Now the problem for that is we have these nerves coming out of here. Now in this instance this disc isn't touching the nerve, so that would be non-problematic. So it might show up on an MRI scan that someone has a bulging disc, but actually they're not hitting their nerve, so that's okay. So lots of people can have bulging discs and not be aware of them. However, what can happen is the disc can bulge and then touch upon the nerve, and that's when we can start to get these sciatic problems running down our spine. And so what tends to happen with these is if we bend our spine, or what we call flexion going forwards, that can cause the disc to bulge further. So that can really aggravate your symptoms. So if when you're bending forwards, it really increases your symptoms, there's some thinking that may lend itself towards a bulging disc. But again, it would need an accurate diagnosis to understand this. However, what's good about knowing that when we flex our spine, it causes the symptoms to be aggravated at the lower back in particular, and we get those sciatic symptoms, is we know that we can help a bulging disc by going into extension. So there's a couple of things that if you are suffering with a bulging disc can help you out in order to ease these sciatic symptoms. So the first thing is to go into extension, as I mentioned. So how do we do this? Well, we do this by lying flat on the floor, on our stomach, and then we can look to slowly arch our back. And we can do this in three ways. We can do this by going up onto our elbows if pain allows. We can do this by then extending a little bit further onto our hands, or we can go fully into what we might term a cobra stretch, where we're going into full extension with the plan of pushing that disc back into place, and you may find that that eases your symptoms. A second thing we can do is decompression. What we're looking to do here is extend the spaces between these areas so that they're not creating that bulge on that disc, that pressure, that push that's pushing the disc out. So what we typically would recommend to people in order to do this decompression, and there are sort of decompression tables that high-level practitioners might use, but what you can simply do around the home is reach for something above you. So something like a door frame, and just try and stretch that back out. Keep your foot in contact with the floor and just extend that back to create that extension, which may help with the disc. A second common issue that we see is that muscles become tight that can impinge that sciatic nerve. A particularly problematic muscle is a muscle known as the piriformis. The reason it can be so problematic in sciatica is that the sciatic nerve runs really close to the piriformis. In fact, for a lot of people, it actually runs through the middle of the piriformis. So if we get a tightening of this muscle, or any of the muscles that can affect the sciatic nerve, they can create a clamping sensation onto the sciatic nerve, which irritates the symptoms. So in order to help with this scenario, what we want to be doing is stretching out some of those tissues. So there's a few areas that we want to particularly concentrate on. Firstly, as I said, the piriformis, which sits within our glute muscles, the hamstrings and the calves. So I would always start by recommending a piriformis or glute stretch to see if this is an area of soreness or can help your symptoms. In order to do this, we lay on our back, we bend one leg. Now this is the side that we don't want to be stretching, if that makes sense. We're going to stretch both sides because it's good to compare. But with this leg that's bent, we then place the other leg, the foot on top of the thigh. Now this is the side we'll be stretching, because then with the bent leg, the initial leg that we bent, we then lift the other leg's foot up towards our chest. And what we're looking to do here is feel a stretch around the hip area. Secondly, we can look to stretch out our hamstrings. Multiple ways to stretch out our hamstrings. But one thing we can look to do is just to lay on our back and lift our leg upwards as far as it can go. Now this may irritate some symptoms, it can do in sciatica, and if it does, just don't go as far as this, go as far as pain can allow. But it's a nice way to stretch your hamstring because it allows your back to remain flat. Thirdly, we can stretch our calf area. Now the way that we might typically do this is by leaning against the wall, placing our feet flat on the floor, and it's important that we keep our heels on the floor. We then look to take the front leg and bend the front leg. We're keeping the back leg nice and straight, and you should be feeling the pull of that stretch in the lower back leg. Another technique that we have to help with sciatica would be what we term self-myofascial release, or rolling, I was going to say, is more commonly termed. And we have some great bits of equipment that can help with this. Now, my favourite piece of equipment is something nice and simple, which is a lacrosse ball. And what we can use with the lacrosse ball is to be investigating some of those muscle structures to see if they've become tight or problematic, and we can relax them. And as I mentioned, a really good place to start is to go into that piriformis. So the way I like to do this is I like to place the ball directly into the middle of my bottom as I sit onto the ball. And so you should almost feel the ball going into what you might term your sitting bone. Once I'm into here, I have a look around this area and find for any tight spots and hold on those. Once I find that area in the middle of my bottom, I then look to slowly roll myself across the top of the ball with the aim of the ball ending up on my hip bone. What you're doing here is you're really tracing along the line of the piriformis. I then repeat that process, coming back to the point where I then end up sitting straight again, and then I use this technique to roll through the tissue. We can then also look to roll through the areas of the sciatic nerve that can become problematic, this being the hamstring and the calf. And another piece of equipment that can be really helpful with this is foam rollers. At the end of this video, I'll link to a video showing you some of my rolling techniques, but I do like using the lacrosse balls I mentioned in the glutes. A foam roller for the hamstring area can work nicely, but we can also use the lacrosse ball. And then once we get into the calf, again, the lacrosse ball works really nicely and can be a good technique to help ease your sciatic symptoms. So that covers our talk today about sciatica. I hope that's helpful. What I wanted to reiterate is that the key in solving sciatica is finding out where the impingement's happening and not making certain assumptions. So we would always recommend you having that assessment done by a trained professional who can give you that advice. But what I wanted to do was give you a greater understanding of what sciatica actually is and some of the tips and theories that we take in order to help you from overcoming those symptoms of what can be a really nasty condition at first, but one that certainly can be managed when we truly understand it and treat it correctly.